Martha is a 73-year-old Caucasian lady. She presented because she's a diabetic. She was having some shortness of breath. And based on some testing that we did with her heart, we found out that she had critical blockages in multiple vessels of her heart. 2 weeks ago, roughly, I brought her to the cardiac cath lab at PLAZA. We did a heart catheterization where we went through the groin into the heart, and with x-rays we're able to visualize how bad the blockages were. And she had a 99% blockage in her right coronary artery. It was a heavily calcified artery. She also had an 80 to 90% blockage in the artery going to the back of her heart, as well as a 99% blockage in the front of her heart. So we fixed the artery going to the back of the heart with a stent. It was a very difficult procedure. It took a lot of time. And we also fixed the right coronary artery, but again, very difficult to deliver the balloon to open up the blockage and place stents because of the amount of calcium that was present. Well, after fixing the first two arteries, the non-LAD arteries, the right coronary and the left circumflex, the LAD is a very important vessel. It's also nicknamed the widowmaker artery. It's the artery where something typically goes bad, or you have complications where you have the artery flap on itself, or calcium plaques come off, or you have any kind of problem with that artery, people die from it. And so I didn't want to take any chances with that vessel. There is a device that we use in the legs to open up very heavily calcified arteries that are blocked through a catheter-based procedure. This device has now been FDA approved for severe calcium in the arteries of the heart. I got specialized training to go ahead and use this, and I felt she was an excellent candidate for giving this device a chance and seeing if we could make the procedure a little safer for her. It spins with an orbit. So if you imagine my finger as the diamond, it's spinning on that axis, but it's also spinning like this in an orbit. Basically has a sanding effect on the calcium blockages that are like lead pipes inside your arteries, and very, very hard, clears a path so that we can deliver the traditional techniques to open these arteries, which are balloons and stents. So, we're very pleased that we were able to bring this new technology to Fort Worth and to the Dallas-Fort Worth Metroplex. From what I understand, it's the first case in this market, in this area. There are going to be a substantial number of patients that are going to benefit from this new technology. In the past, people who've had severe blockages like this would either not have anything done and be treated with medications because the balloons would not fit through these blockages. They were too tough to get them through and open up the blockages. Or they would have open heart surgery, and so they would have an even more invasive procedure to get past that blockage. Or they would have other types of atherectomy devices, but are not currently FDA approved for calcium-specific lesions like this one is. And after we drilled it, we were able to put the balloon through that blockage like, it was like butter. We were able to get through it very easily, and the stent went very easily and after that. And so we are basically making a very complex procedure that might take several hours and reducing the time of the procedure, reducing the complications in that procedure, and making it a lot easier on myself as the operator to get the stent where it needs to be. The benefits of PLAZA are that we're able to do these new technology device procedures in a way that is safe and effective and can help people down the road. I think that on a kind of a comical note, it turned out that diamonds for this lady were truly her best friend. For a patient, for a woman with critical coronary calcification in her arteries, diamonds truly are a woman's best friend in this scenario.